In this beginner's video, we'll answer the question, what does Medicare Part B cover? Stay tuned. This video will help you understand what Medicare Part B does and doesn't cover. Hi, I'm Renee Van Staveren. I work with hundreds of Medicare agents across the nation, and I lead Medicare education at Connie Health. Before we discuss what Medicare Part B covers, first, let's discuss what Medicare Part B is. Medicare Part B is the United States federal health insurance program, which is often called Original Medicare. Medicare Part B is the medical insurance portion of Original Medicare. It's the complement to Medicare Part A's hospital insurance. Now, what is Medicare Part B medical insurance for? Medicare Part B covers two types of outpatient care. First, preventative services. These are healthcare services used to prevent illness or detect it at an early stage, when treatment is most likely to work best. Medicare Part B also covers medically necessary services. These are services or supplies that are needed to diagnose or treat your medical condition and that meet accepted standards of medical practice. Medicare Part B covers medically necessary services when they are delivered by a Medicare-assigned healthcare provider in a Medicare-approved facility. Now, let's review the preventative services that are covered by Medicare Part B. The good thing about this is that many preventative services are covered 100% by Medicare Part B. Here are the preventative services that are typically covered if the provider accepts Medicare assignment: flu, hepatitis B, and pneumonia shots. Shots not covered by Medicare Part B are typically covered by your Medicare Part D prescription drug plan. Other preventative services that are covered include bone mass measurement, screenings for cardiovascular disease, glaucoma, depression, alcohol misuse, HIV, hepatitis B, hepatitis C, and screenings for sexually transmitted infections. Enrollment in a Medicare diabetes prevention program, diabetes screening and self-management training, obesity behavioral therapy, medical nutrition therapy services, screenings for colorectal cancer or colon cancer, prostate cancer, and lung cancer, mammograms for screening for breast cancer, pelvic exams for screening for cervical and vaginal cancer, counseling to prevent tobacco use and tobacco-caused diseases, abdominal aortic aneurysm screenings, blood-based biomarker tests, and yearly wellness visits. If you're ever wondering if a service is a preventative service covered by Medicare Part B, call and speak to a local licensed Connie Health agent who can help. I truly hope that you're finding this video to be valuable. If you are, take a moment and hit the like button below. And watch this video till the end, where I'll share more helpful links to support you on your Medicare journey. Now, let's get back to the video. If you have an illness, Medicare Part B will typically cover outpatient services and supplies needed to diagnose and treat your medical condition. Some of the services and supplies covered by Medicare Part B may include services and supplies related to specialist visits, such as cardiology, radiology, orthopedics, and others. Mental health services. There's great news for this. Coverage for mental health services was updated in 2024. Medicare Part B may now cover inpatient, outpatient, partial hospitalization, and intensive outpatient program services. Medicare Part B may also cover clinical research, ambulance services, durable medical equipment or DME. Durable medical equipment could include hospital beds, crutches, walkers, canes, lancets and test strips, insulin pumps, and glucose monitoring, among others. Medicare Part B may also cover outpatient surgery, physical therapy, chemotherapy, dialysis, and limited outpatient prescription medications. Before having a service or supply provided, we recommend that you speak with your provider to ensure that it's covered by Medicare. If you don't take this extra step, you could end up having unexpected out-of-pocket expenses. In addition to asking your provider or your Connie Health agent, you can also visit Medicare's website at medicare.gov coverage, you can search to find if Medicare covers your item, service, or supply. We talked a lot about what Medicare Part B does cover. Now let's touch on what Medicare Part B doesn't cover. There are many items, tests, and services that Medicare Part B doesn't cover. These include routine dental, vision, and hearing, such as vision exams, eyeglasses or contacts, hearing aids, dental extractions, or dentures, among others. If you'd like routine dental, vision, or hearing covered, a Medicare Advantage plan could be a great option for you. You should call and speak to a local licensed Connie Health agent who can help you review your Medicare Advantage plan options. Now, let's talk briefly about the costs of Medicare Part B. When you receive preventative or medically necessary services with Medicare Part B, you may be charged a deductible and coinsurance costs. Medicare Part B has a deductible that changes annually. Every year that you're enrolled in Medicare Part B, you must pay your annual deductible before Medicare will begin cost sharing with you. Almost any item or service that Medicare Part B covers will count towards your annual deductible. Now, once you've paid your annual deductible, that's when Medicare Part B will begin cost sharing, but that also means that you'll begin paying coinsurance. After your Medicare Part B deductible is met, you begin paying a 20% coinsurance for Medicare approved doctor services, outpatient therapies, and durable medical equipment, or DME. Now, this is really important to note. There is no cap on the 20% coinsurance. So that coinsurance amount that you pay for services could go on and on and on. There is absolutely no cap. And this is why medigap plans were created. Medigap plans help you pay for some or all of the out-of-pocket coinsurance costs that you would traditionally be paying. If you're curious about Medicare Part B's costs, including the deductible and more information about coinsurance, Connie Health wrote an article all about it, and it's linked in the description below. Out-of-pocket coinsurance costs can add up quickly, which is why the majority of people enrolled in Medicare are enrolled in a supplemental plan, either a Medicare Advantage or a medigap plan. If you'd like to learn how a Medicare Advantage or a medigap plan can help you pay for Medicare Part B out-of-pocket costs and shield you from potential medical debt, call and speak with a local licensed Connie Health agent who can help. Connie Health wrote an in-depth article all about Medicare Part B's coverage. To read about Medicare Part B, visit the link in the description below. In this video, we answered the question, what does Medicare Part B cover? We learned what Medicare Part B does and doesn't cover, plus how to avoid unforeseen out-of-pocket expenses and potential medical debt. If you like this video, hit the like button. If you want more videos like this, subscribe to our channel. Until next time.